Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on what are the changes that can be observed in the body of a woman when she has vaginitis. So this is pathology. The first variety of vaginitis is bacterial vaginitis. There is a bacteria by name Gardnerella vaginalis. This is one of the commensals which lives in the vagina of women. Sometimes what happens is its number increases, or the amount of bacteria in the women increases, then this will lead to vaginitis and also white discharge. In this, the discharge is grayish or whitish in color, and when the smell here is distinct, the smell is foul, and also it is fishy discharge. It is fishy odorous. When the women gets the vaginal fluid, the smell of vaginal fluid as fishy, it is mostly due to bacterial vaginitis. They can be itching and they can be irritation also in the private parts. The reason for this is mostly unknown. And also women that smokes more are at high risk of having this vaginitis. And also when the woman has a new sexual partner or multiple sexual partner, she can land up into this disease. And also douching means if you are washing the vagina more than once a day, or several times a day, this is known as douching. And in such women also we can see this bacterial vaginitis or bacterial vaginosis. Next form of bacterial vaginosis is gonorrhea. This is a sexually transmitted diseases. This is caused by the bacteria Neisseria gonorrhoeae. The distinct feature in this disease is there will be copious amounts of white discharge, and also there will be painful urination. Urination is painful in this women. And coming to the next variety of vaginosis, that is fungal vaginosis. Here the causative organism is Candida albicans. The discharge here is thick, lumpy, it is creamy, and it looks like a curd. And also the women will have itching, there will be irritation, there will be redness of vulva, and also dyspareunia. Dyspareunia means there will be painful coitus, or intercourse will be painful. Some of the common risk factors for this is diabetes and prolonged use of birth control pills, prolonged use of antibiotics, and also stress. If the woman is in stress for a very long time, she can land into fungal vaginosis. And the next one is protozoal vaginitis or vaginosis. Here the causative organism is Trichomonas vaginalis. This Trichomonas vaginalis is also a commensal. It lives normally in the vagina of the female. Due to some abnormal things or changes in the body, the load of this protozoans will increase in the women's vagina, and that leads to this disease. The distinct features here are the discharge is yellow in color or white in color, and also it is frothy. It is frothy discharge and also putrid smelling. It smells as if something is rottening or the meat is rottening. There will be the external female private parts here are painful. They can become red, they can become tender as well. This is an STD, sexually transmitted disease, and this can also spread through sharing of towels or bath suits. The important thing here to remember is men will also have this commensal within their body. They act as carriers. They will not show any signs and symptoms. When they go and have an intercourse with the women, that women can show the signs and symptoms. And also some women are also act as carriers. Even some women will not have any symptoms if they are infected by this organism, and it is asymptomatic both in women and men. It is asymptomatic in most of the men. It is asymptomatic or it is without symptoms in some women. Next type is viral vaginitis. It is mostly genital herpes. This is caused by the virus herpes simplex. Here there will be excessive discharge, and also there will be painful. The external genitalia or female private parts are painful. They can be blisters and they can be heavily itching. When you have these symptoms, it can be due to viral vaginitis. It is due to herpes simplex. There can be vaginitis because of chemical and mechanical irritants. Mechanical irritants will be like having multiple sexual partners, or you are indulging in sex several times a day. And also if you are undergoing douching means washing the vagina again and again. If you are applying some perfumes, or you are washing regularly, and also if you are using some chemical lubricants, these also can cause mechanical or chemical vaginitis. And coming to atrophic vaginitis, this is one of the common vaginitis we see in elderly women. Here what happens is after you reach the menopause, there will be less amount of estrogen in your body. Because of less estrogen, the inner lining or inner mucosal lining of vagina will get atrophied or becomes thin, and this can lead to the pain of vagina, and also there will be some discharge. This is known as atrophic vaginitis. And also next type of vaginitis is due to pre-cancer and cancerous conditions, or also when there are some polyps in the vagina or cervix of the women, it can lead into this vaginitis. They can be brown color discharge or blood stained discharge coming out from the vagina of the women. This is due to polyps, cancers, or precancerous conditions of vagina.